I'm Denise Callaway, your host for Connect MKE. Thanks for joining us today. February is American Heart Month. It's a time to pay special attention to how we understand, prevent, and treat heart disease. Heart disease is the leading cause of death in America, but there are things we can do to protect our health and our hearts. Here to give us the information we need is Katie Connolly, Executive Director of the American Heart Association Milwaukee chapter. Welcome, Katie. Thanks for being with us today.
Hi, Denise. Thanks for having me.
Heart disease kills more Americans than any other disease. Yet people are actually more afraid of dying from other diseases, cancer in particular, than heart disease. How do we share the real risk of the devastating impact of heart disease?
Well, things like today, having this conversation with you definitely helps to spread the message of the need to know your risk factors, the need to know your numbers, the conversations that you need to have in order to prevent heart disease from ever starting. Certainly, there are things that you can do to reverse it, but really what we are wanting to do is prevent it from ever happening. And so things like knowing your blood pressure, and not just the one time a year you go to a doctor and knowing those numbers, but regularly checking your blood pressure and knowing what that number is, your cholesterol levels, making sure you're getting enough sleep, certainly your diet, your any kind of exercise, and not smoking are definitely key to being able to reduce those risks.
When we talk about knowing your numbers, what are some of the things that when we go in for those doctor's appointments once a year that we should be asking our doctors about to make sure that we're trying to be proactive as well?
Certainly. So when the doctor or the medical professional takes your blood pressure, making sure you're asking them what that number is. Oftentimes it's done and then it's written in your chart, but then you're never told what that number is. So being told what that number is, and then even asking another question to say, is that in the normal range? Because for someone who doesn't know what their blood pressure should be, hearing some random number isn't really going to benefit them in any way. So discussing with your medical professional the right range in which your blood pressure should be. The same thing, if you have your cholesterol tested, finding out not only is it in the normal range, if it is elevated, what can you do to bring those numbers down? Same thing with an elevated blood pressure. What are those steps that you can take in order to bring those numbers down? So just really asking those questions is really important.
You mentioned that it's important that we also know our risk. What are some of the illnesses that we may have or some of the other conditions that we have that can really increase our risk of heart disease?
Some of it is really out of our control. There are genetics that play a role in whether an individual is at higher risk for heart disease. Another thing that plays into a risk factor is where you live, really. Honestly, and having that access to not only quality healthcare, but having access to healthy food on a regular basis. Being able to have access to be physically active and to get out and be safe when you are, out being physically active. So it's important to not only know your familial history and what those genetics play in your heart disease risk, but then also having that ability to be able to exercise safely and regularly. And that's really what we're working on at the Heart Association, is trying to create those spaces so individuals can feel safe out walking. Getting to a grocery store should not be a challenge. It should not take 3 buses to be able to get to your local grocer. Ensuring that those local convenience stores, those corner stores, do have fresh fruits and vegetables available for a quick grab and go, and that they're easily accessible when you walk into that corner store, that they're not like way in the back where maybe you would have to pass the potato chips and the soda along the way, but that you would actually be able to walk right in, grab it, and leave immediately.
It's interesting because I think that it would surprise some people that the Heart Association is really taking those efforts to work on those preventive things that people can do.
When people do think of the Heart Association, they do typically just think research, I'll go there when I have a heart event or when I have a cardiac event or when I have a stroke. I'll look them up on the internet and find out what they have to say. But really, you know, we're going to be 99 years old this year. So next year is our 100th anniversary. And for the last 99 years, we have served as, you know, that resource for individuals when they do experience an event. And over the last several decades, we've really been looking at, well, what stops those events from ever happening? And things like our environment are proving to be what's helping us to prevent those events from happening. And so being able to be in the community and have that community impact is really important to us. And just this last summer, we worked to advocate for the Milwaukee County executive to pass funding, or actually basically allocate funding, not pass it, but to allocate funding for $1 million from ARPA funding that was able to go toward SNAP funding. So that means that if you are a SNAP recipient and you go to a farmer's market, and typically you can't use your SNAP funding at a farmer's market. Now you can at some select farmer's markets in the area, and you can use your SNAP funding to double down and actually get like a 2-for-1 on fresh fruits and vegetables. Prior to those dollars being allocated, you were never able to really use any kind of SNAP funding at a farmer's market.
And as part of that too, it's helping people understand what those healthy choices look like that can help prevent heart disease.
And so, right, part of that is just the education and awareness of, you know, why choose the fresh fruits and vegetables at the farmer's market. Not only is it beneficial to you as the recipient of eating those fresh fruits and vegetables, but it's also beneficial to our local farmers. And, you know, it puts back into our local economy, which is really important as well.
One of the things that people do need to better understand, all of us need to understand, is we've talked a bit about prevention.
Yeah.
But if you're in that situation where you may be having a cardiac episode, how do you know what those symptoms are?
So it varies from individual to individual. And for women in particular, many times women don't show any sign or symptom of a heart attack. So when we think of heart attack, we typically think of, you know, this heavy feeling on my chest, maybe some pain in my left arm, my jaw, having some discomfort. And those are signs of someone having a heart attack. But typically in women, they present as almost like stomach-like, flu-like symptoms, indigestion. It's very different for women. The signs and symptoms are very different for women than they are for men.
One of the things that it seems like people, because maybe we don't, again, realize the risk that heart disease has for us, people aren't always ready, even when they have those symptoms, to seek immediate help.
Yeah, there's a lot of fear in dialing 911. And there's the, I don't have insurance. What if it's really not, you know, an issue? So there's fear with that in dialing 911, but then there's also fear of going to an emergency room or emergency clinic, because there is that, what if it's not? But what if it is kind of what, you know, we need to be thinking and asking, what if it is that event? And you need to seek that medical assistance immediately. You need to either be dialing 911, which is the better way to get you to medical help, or you need someone to be getting you to the emergency room very fast, but safe.
When we make that decision that we think we have some kind of a heart episode going on, how important is it to act quickly and not to put that off?
Yeah, definitely don't want to put it off, because it could be a different kind of cardiac event. You know, it could be a heart attack. It could be AFib, which is another heart condition. It could be signs and symptoms of a stroke. It's just really important to not push it off and say, well, I'm just going to get some sleep, or if I just lie down, because unfortunately, if you just lie down or just get some sleep, it's not going to resolve the issue, and the outcome could be pretty devastating.
Are there some illnesses that really make us potentially more likely to experience a heart episode, a cardiac episode?
No illness in particular. Certainly the category of heart disease puts you at risk for a cardiac event like a heart attack. And heart disease is classified as just what I said before, having high blood pressure, having high cholesterol, diabetes, type 1 or type 2 diabetes. Those are all in the category of heart disease. And so certainly having one of those diagnoses could lead you to be at higher risk for heart disease, but there's not like a particular illness that would then bring on any kind of heart attack or heart disease.
Do people necessarily think of those heart-related diseases that you just mentioned? Do people even think of those as really being heart disease?
No.
So I have high blood pressure, I have diabetes. They don't, there's no linkage to the heart diseases.
Right. So, when someone thinks of heart disease, typically they think of heart failure, or I already had a cardiac event. They're not thinking about the fact that by having those risk factors and being high on that risk factor list, that you actually are in fact a person with heart disease.
You mentioned a little bit earlier the important role that genetics can play in heart disease. How can genetics impact heart disease?
So certainly, going back and looking at your parents' heart history and seeing, did they have high cholesterol? That means you're more likely to have high cholesterol. Did they have high blood pressure? You're more likely to have high blood pressure. But then you take it even a step further. And if you have African-American or Hispanic family members, you're at an even higher risk for heart disease or risk for a stroke. And that goes back to those two populations having higher blood pressure, typically having higher cholesterol levels, typically.
And there are things you can't always do about your genetics.
Right.
That awareness is, it would seem, critically important.
Yeah, having those conversations with your family, just asking, and asking not just your parents, but siblings of your parents, or talking among your own siblings about your health and your heart history, and knowing, because that plays into you certainly, but then a next generation, that they need to be aware that this too can play into their health and their heart, their heart health.
You mentioned too that there are some things that you can do to help prevent or help minimize the heart experiences that we might have. You talked about diet. Talk a little bit about exercise, because oftentimes we hear a lot, oh, you need to walk 10,000 steps. You need to do this, you need to do that. What are some of the things that people can do to increase exercise, decrease risk of heart events?
So the Heart Association recommends that adults receive 120 minutes of moderate exercise a week. And we recommend that children receive 60 minutes of exercise daily. That is why, as the Heart Association, we have advocated for PE to stay in schools, because it is so critical that those children are having some kind of exercise during the day. And for many children, that's the only time they're getting any kind of exercise, is at school. Same thing goes back to, diet. Again, back in the school systems, we're advocating that healthy meals be provided that are following particular guidelines, because in many cases, those are the only healthy meals, or the only meals, that children receive. And so being able to be active, and not just as an adult, but children, it's really important that we start that at a young age, because we're starting to see, higher instances of childhood obesity. We're starting to see children with type 2 diabetes. We're starting to see children who have high cholesterol. And that's just going to continue to, advance as they get older if those habits don't change.
And heart disease is not just something that affects people who are older.
Right. It's a real quiet disease. It's not very visible. And a lot of people don't talk about it, because sometimes it's because I didn't take great care of myself that resulted in an event, in a cardiac event. And sometimes it's, this is what was handed to me, and this is why I had a cardiac event. But it is not, an older person's disease by any means. It doesn't discriminate. It affects everybody.
One of the things that we've all learned, particularly recently, is the importance of CPR. I don't think there is anybody who wasn't struck by the incident that happened to Damar Hamlin in the Buffalo Bills when he had that sudden cardiac arrest right there in front of literally millions and millions of people.
Yeah.
How has that helped reinforce the importance of CPR?
Certainly has. Lots of questions have come about in how do we learn CPR? Why should we know CPR? And there's a lot of different ways you can learn CPR. You don't have to take, the 4-hour class that we probably took when we were younger in high school as part of a PE course. You can do a 1-minute video, watch a 1-minute video. And science and research is showing that even by watching that 1-minute video, you are more likely to jump in and perform hands-only CPR than if you never watched any video or were never exposed to any kind of training. So it doesn't have to be this long, drawn-out training. It can literally be 1 minute to save someone's life. And just today, Damar Hamlin launched a 3 for CPR challenge. 3 for CPR challenge. So obviously he's number 3. And then we want you to take 3 steps. And it's 1, watch that 1-minute video. And it's very easy to get to. You just go to heart.org and it's right there. It's on our homepage. Then we want you to donate to the cause. It's very important that we continue to fund the mission of the Heart Association so that we can continue to make CPR as easy as possible for the average person to be able to do, and that we can continue to do that research and we can continue to educate and share that awareness. And then 3, we want you to share it with other people. Share what you learned, spread the message, and get as many people as possible to know hands-only CPR. It can save a life. We obviously saw it happen with Damar Hamlin. He was in the right place at the right time. Most people on the sidelines are trained for those type of events to happen. And they were able to get to him immediately, which is what actually allowed for him to have the outcome that he has. That we know that delayed CPR, even minutes of delayed CPR, can decrease that person's chance of survival significantly.
Katie, this is such important information. Thanks for being with us. And to get even more information on how to take better care of your health, visit the American Heart Association website at heart.org. The American Heart Association is paying special attention to efforts to educate women about their own heart health awareness. Coming up, we'll talk to a local woman whose journey to heart health is both a cautionary tale and an inspiration for us all.